Hi, brother teacher again, with part 2 of my first video on how to lower your blood pressure naturally. This is part 2. Now, this video is a complement to the first one. This video is very much necessary, and the video series between the two of these would be incomplete if you don't have this one. I was a bit remiss by leaving this section out of the first one, but the first one hopefully got you to think, and maybe this one will drive it home for you. Let me give you a quick disclaimer. I've told you before, I'm not a medical doctor. Medical doctors study allopathic medicine. They don't learn nutrition. They don't learn natural and homeopathic medicine. They learn how to prescribe medication, pharmaceuticals, and they learn how to prescribe and suggest surgery. Only those two things. This video in no way is intended to diagnose any condition and to offer you a cure for those possible conditions. It's for entertainment purposes only. It's for educational purposes. Please govern yourselves accordingly and read between the lines. I made this statement because by law it's really necessary for me to do so. So now, follow me down this rabbit hole just a little bit if you would. Ladies and gentlemen, and my dear friends out there that's listening to me right now, I need you in your undivided attention. I'm not going to be with you very long. I'm going to try to drive this home in just a few simple statements. I talked about what you should do to lower your blood pressure in the first video. I mentioned removing stress, physical stress, inflammation, whatever's causing those inflammation issues, mental stress, anxiety, worry, those types of things, emotional, so forth. Improper diet, consuming alcohol and even tobacco products, and lack of exercise, and not getting proper rest. There, I covered all of those items again. So now, let's touch on medication. A pharmacist told me that every drug has a side effect. And the side effects are not necessarily pleasant. Many drugs have side effects that can cause injury and damage to your internal system, your organs. Even though they say they're supposed to help relieve pain and discomfort, but they also cause pain and discomfort and even death. I'm not smiling because it's true. And if you ask a doctor to be perfectly honest with you, they'll tell you the same. If you do your due diligence and you study and you research for yourself, you'll find the answer to be the same. Drugs cause more harm than good, because we came from nature. You hear me harp on this all of the time. So we must consume nature in terms of our sustenance or our food. But because we're consuming and putting things on our body and in our bodies that's not natural to our bodies, we become riddled with diseases over time. It's the truth, and you know it is. So now, when you take a pharmaceutical drug, Lipitor, metoprolol, or any other drug that's designed to lower your blood pressure, you are making the condition worse, and you're causing other conditions and ill effects inside your body that you don't see readily because it's happening internally. And ultimately down the road, some years down, and it's going to vary from person to person, you're going to end up with cancer or some other debilitating condition as a result of taking drugs. This is a no-brainer, ladies and gentlemen. So someone says, well, brother teacher, how is it that the high blood pressure medicine is lowering my blood pressure? Isn't it a good thing? Here is where the rubber meets the road. You must understand, you must comprehend that anytime you and I receive a headache, there's something that caused the headache. Most people will go to a pharmacist or a doctor to get a pain pill to relieve themselves of the headache. What caused the headache is still there. Anytime you have chest pains and you tell the doctor that you're having chest pains and they give you a pain pill or a prescription to cause that pain to go away, all they're doing is masking the pain so that you're not in discomfort. But the problem that's causing the chest pain is still there. If you're having stomach problems and you have gastritis, or if you have acid reflux, you take a prescription or an over-the-counter medication to cover it up, to mask the discomfort so that you feel as normal as you possibly can. But what caused the problem is still there. If your habits, if the things that you've been doing are still the same, you're going to get the same result. You're not supposed to be taking antacids for the rest of your life. You're not supposed to be taking pain pills for the rest of your life. You're not supposed to be taking any kind of pill for the rest of your life while you're destroying and shortening your life at the same time. You need to find out what's causing the problem, and you resolve that issue, and you won't have to take any medication whatsoever. Now, as it relates to hypertension or blood pressure, high blood pressure, if your blood pressure is high, that's your body's warning sign. It's your body's warning signal telling you that something's going on that causes your blood pressure to rise. What is your body doing when your blood pressure is high? It is trying to deliver oxygen through your blood to your tissues and your cells. And it can't do it effectively because the arteries that's responsible for transporting the blood have been compromised. They're weakened, they're more narrow than normal, so the blood has to force it through there, or the heart has to force the blood through there to get the necessary oxygen and nutrients to your body. That's why it's there. That's why it's high. That's why your blood pressure is high. It's your body's defense mechanism. High blood pressure is a defense mechanism of your body. It's saying something's wrong. My blood is not flowing naturally to all of its body parts, so I need to make sure that it gets there, so I have no other choice but to raise the blood pressure and force the blood to get to all of those body parts. Now, herein lies the rub. What's the problem that's causing it not to get through in the first place? The problem is you. It's the truth. It's you. It's your lifestyle. I mentioned all of the things. It's your diet. The processed foods, all of the junk food, the restaurant foods, they're clogging your arteries. All of the things that you buy from the pharmacy that you keep popping pills in your mouth for whatever reason. I'm taking aspirin, I'm taking NSAIDs or non-steroidal type drugs, I'm taking ibuprofen, I'm taking Tylenol. All of these things are killing us. Just because you have a headache, Why don't you find out why you have the headache? Start doing some investigation of your own self. Take the time out for you and find out why you have these issues. Why do you have stomach problems? Take some time out and figure it out. Stop being so concerned about where your boyfriend is or your girlfriend is or what's on the television to watch, or I have to go to my favorite friend's house when I'm having health issues. Address your health issues today, and you become the scientist. You become the doctor in your own existence, instead of relying on somebody to write your prescription for something that's going to kill you ultimately. You get what I'm saying? So, again, on the high blood pressure, if your arteries are the right diameter, now things change with age, we know this, but if your arteries are the right diameter and the blood is flowing naturally through the arteries and to your heart and back from the heart, you're cool. Your blood pressure is going to be naturally where it's supposed to be, but it's only going to be high if you've done something to compromise your own health through your own bad habits: smoking, drinking, your diet, your lack of exercise, your stress, your lack of rest. All of these things cause hypertension. So guess what the answer is? What the remedy is to remove these things from your life, and then your high blood pressure goes away. So don't think of high blood pressure as a disease. Disease means not at ease. Your body's not at ease. So when are you going to put it back at ease? So it's not at disease. When are you going to put it back at ease? Because that power lies within your own hands to do. You just have to do it. I'm not talking about remote and extenuating and preconditions that you had as a child, something that you was born with. Those are few and far between. I'm talking about most people's problems with hypertension or high blood pressure. I'm not talking about those abnormalities that 1% of the population has. Those are anomalies. Okay? I'm talking about everybody else. So, ladies and gentlemen, before I conclude, remember this. Most of the things that are wrong with us and happen to us physically and mentally, in terms of our health, are caused by us. And we should resolve those issues by us and stop looking outside of us for the answer, when the answer was within us all along. This brother teacher, may Yahweh bless you and keep you. I'm out.